Staffing and Scheduling by Kylie Garber. So just a little overview about some things that we're going to be looking at during this presentation includes staffing and scheduling and how it's really pivotal important for proper patient care. So obviously the higher ratio of RNs to patients is going to equal higher quality of care. So the more RNs that I have on a unit to take care of a certain number of patients, the more attention each of those patients is going to be able to get to make sure that everything's going well and fine for them. But the goal of staffing is to get the correct ratio of nursing staff to patients, and that can be kind of difficult when it comes to how cost effective staffing is for the number of patients that are on a unit. So one way of doing this is by looking at the workload patterns, levels of care, and the census on specific units. The Joint Commission is saying that an organization by itself must meet staffing criteria. And when you think about that, one may say, why not make a mandate that, like throughout the country, that this is how many staff members should be on this type of unit? And that sounds great, but it's kind of like what I mentioned before. It can be difficult for groups to implement when it comes to cost and when it comes to just the amount of staff that they already have hired, they may not be able to fulfill that type of mandate. And that's why it's per organization. So one way of looking at this staffing and proper staffing is patient classification systems. Patient classification systems look at the workload needs and the staff needs within a unit, and then how congruent that is to the patient needs. So this is analyzed mid-shifts every day. So it looks at the oncoming shift and their staff, and it says, are these staff members appropriate for this upcoming shift? And that sounds like a really great way to look at things until you see and you think about, well, what if an admission comes in on the next shift? And that patient is more acute than the patients that are currently on the unit, they may need better staffing. Some say it's a bit short-sighted. So another way to look at that is something kind of similar, but it's demand management. And demand management is going to predict and control the demand on a unit. It's best practice for staff. It's looking at the best practice for staff, and it's based off of historical data. It looks at patient progress patterns and then tries to expect the outcomes for specific types of patients. So with that expectation, they think that maybe they can predict staffing needed for the next few days, depending on the patient progress patterns. So then there's nursing care hours and determining the nursing care hours. So NHPPD is nursing hours per patient day. So the nursing hours per patient day is equal to the total nursing care hours divided by the number of patients. This is going to trend the workload for every day of the week. So the staffing needs are related to the patient diagnosis. So it'll be different for different units. So for a unit like a med-surg unit, there could be 5 to 7 hours of nursing care hours on that unit, whereas a critical care unit could be 10 to 24 hours, or a burn patient unit or something of the like could be 24 to 48 hours. Then we have to look at determining FTEs, and FTEs are full-time equivalent. So 1.0 is 40 hours of work per week. So that's 52 weeks in a year. That means 2,080 hours per year for a 1.0 FTE. So for example, a 1.0 FTE could be fulfilled by one employee or by two through a 0.4 FTE and a 0.6 FTE, or any type of different calculation within that. Managers need to know how many FTEs are appropriate for their unit, and they can look at the hours of work for 2 weeks, the daily census, and hours of care needed on their unit. they take the total patient days divided by the days of the year to get the average daily census. And this helps them know how many FTEs would be appropriate for their unit. Another thing that's important with FTEs is the staffing mix. So you have your aides, your LPNs, and your RNs, and this mix, they want to get the proper mix with the proper FTEs to properly staff a specific unit. Then determining staff distribution. This can be unit dependent, shift dependent, and for example, on a surgical unit, they may be more busy Monday through Friday. So they may want to staff better during those days. Or on something like a med-surg unit, sometimes the nighttime is hopefully a little less busy, and so they may try or not try, but have a decrease in staff during nighttime because of the less busy times. But there are some areas that cannot predict these busy times, such as labor and delivery and the emergency department. They may have more busy times of the year, but they can't always be predicted. So one thing that can be done is block staffing. This is a set mix for every shift. It can involve increasing staff for busy times, but it is a set mix. It doesn't look at patient acuity during the specific shifts. It was found in a study that it can be helpful in the operating room. For the OR, it was found to be more successful by the day and not by the hour. Also, block release could be used in these instances. Like, for example, a block of time could be released from one physician or one provider to another that's less busy, and this can help prevent any backup or underutilization. The nursing shortage. So 8 out of the 12 largest economies are in a nursing shortage. The U.S. has a third of its needs met. There was a prediction for over 400,000 new nursing jobs needed between 2014 and 2020. So this is a question I'm asking myself. What's contributing to the nursing shortage? That can be stressful work. The age of nurses is increasing and then they're getting out of nursing. There's a low professional status in some places, and that can all contribute to the nursing shortage. So the Nursing Now campaign helps nurses have a voice in health policy making. And it also helps invest into the nursing workforce, recruit nurses into leadership positions, conduct research, and best practice nursing sharing. So, because of the staffing issues, scheduling is really important. And we need to continue to become more and more creative with our scheduling because of the scheduling and the staffing problems. So that creativity can include an array of different shifts like 4s, 8s, 10s, and 12s hour shifts. Some of the positives to these different shifts is an increase in staff is easy during high workload times because of the shorter shifts and the longer shifts. It can also help with staff satisfaction and improvement on nurse availability because nurses are more free to have different options for the amount of hours they're working and when they're working. Some negatives can include a disruption of quality of care. If nurses aren't on the unit very long and don't have much time to get their work done, they may not be able to pay as much attention to their patients. It can also be pretty difficult to communicate with managers and other members of the care team if nurses aren't there for long periods of time. There's also self-staffing and self-scheduling. Self-staffing can help back up staff with an increase when there's an increase in workload. If the demand is increasing, so must the staff, but then at the same time, if the demand is decreasing, the staff must as well. With self-scheduling, it empowers the staff to make their own schedule, and this can also help with staff satisfaction. Supplementing staff can also help with staffing problems. They could use PRN, part-time, internal float pools, and outside agency nurses. This can be really helpful for unscheduled absences, increased workload, and staff vacancies, and that can be done through the internal float pools, things like open shift management where they post the schedule online and then the staff can pick up their shifts, external float pools, and that's like the traveling nurses, the agency nurses, and that can be a good thing, but it can also be just a little bit harder because there can be a concern for quality. If agency nurses are coming in, they may not know all the ins and outs of one hospital. Also, supplementing the aides on a unit. Sufficient staffing to help RNs is really important, and they're just as important as members of the care team. So an example here, if you look at the data, there's the number of hours per FTE in 2 weeks, and that's 80. And this is just an example. And then there's the number of days of coverage in 2 weeks, which is 14. And then here, this floor's average daily census was 26. Then they look at the average nursing care hours from the patient care system, and that's calculated at 6.15. So if you multiply the average nursing care hours by the days in staffing period and the average patient census and divide that by the hours of work per FTE in 2 weeks, then you get how many FTEs would be needed for a specific unit. For this one, with the 6.15 patient care hours and the 26 average daily census, you need 28 FTEs. Let's take a look at this YouTube clip.
Demand for nurses and other healthcare professionals has been rising for several years. At the same time, shortages of clinicians continue to grow. The gap of unfilled healthcare jobs is getting wider. Shortages of nurses are now being felt in scheduling and staffing at hospitals and other healthcare facilities throughout the nation. AMN Healthcare and Avantis conducted a survey of nurse managers to examine nurse scheduling and staffing problems and solutions using predictive analytics. Nurse scheduling and staffing problems include understaffing, last-minute schedule changes, calling in sick, specialty vacancies, imbalances between experienced and novice nurses, sudden changes in patient acuity. The survey showed that approximately 3/4 of nurse managers say they are very concerned about staff morale due to these problems. Nearly 70% say they are very concerned about the impact on patient satisfaction. And more than half say they are very concerned about the effect on the quality of patient care. Predictive analytics can forecast patient demand and nurse scheduling and staffing needs months into the future. Most nurse managers say they would be very helpful in reducing the daily problems they face. Technology-enabled solutions using predictive analytics are available to solve nurse scheduling and staffing problems, but 80% of nurse managers don't know about them. Most nurse managers still rely on very basic scheduling tools, paper-based tools, and simple digital spreadsheets. Nearly 1/4 of nurse managers say they don't use any scheduling tools at all. Predictive analytics are already used in many industries for resource management. Now it's available to predict patient demand and staffing need for accurate scheduling and staffing. Healthcare providers that utilize predictive analytics have positive outcomes: efficiency in agency staffing, increased staff satisfaction, improved staff retention, reduced open shift and bonus shift incentives, significant savings in labor spending. To learn more and to download the full survey, visit AMN Health.
This chart just shows the difference between fixed staffing models and flexible staffing models, and how fixed staffing models, the strengths are it's easy and simple to calculate and work out, but the problem is that it doesn't consider the severity and the acuity of patients, whereas the flexible staffing models consider those things, even though it may be more difficult to calculate and may not be as feasible to calculate using the existing staffing grids or whatever the institution has implemented. But optimal staffing is so important, and the ANA has found that this is done best through flexible staffing models, and it can improve patient satisfaction, quality of life, and decrease medical and medication errors, as well as patient mortality, hospital readmissions, and the length of stay. It can also decrease falls and pressure ulcers, central line infections, healthcare-associated infections, and decrease patient care costs by decreasing the readmissions. This can all help nurse satisfaction by preventing the nurse fatigue, helping with nurse safety, nurse retention, and job satisfaction. And these are my references.